Your shoulder joint is naturally the most unstable joint in the body because it is the most mobile joint in the body. With this privilege also comes a risk of dislocation. When you dislocate a joint, it comes out of its socket. Usually it falls forward and downward out of the socket, and with this motion, ligaments, muscles, tendons, and nerves in the area will get stretched and pulled way beyond what it is normally used to. This creates multiple strains and sprains in the area, possible numbness and tingling, and definitely swelling. There are possible complications from a dislocation where you tear the cartilage of the shoulder joint, but that will have to be for another video. The first stage of rehab is important to help keep some shoulder mobility and prevent stiffness from setting in. Being in a sling doesn't mean you can't move the arm. The sling is used to help support the loose shoulder joint to keep it in place in its early stages of healing. This first stage of exercises will be for the first 1 to 3 weeks of your recovery, where you will still need to wear the sling for support. At this stage, make sure the exercises are pain-free. If any of these exercises do not feel good or your shoulder feels uncomfortable and unstable going into the range, either don't do the exercise or do not go that far into the range of the exercise. This is a vulnerable stage for your shoulder and you need to be careful. Breathe in and bring the shoulders up towards your ears. Then exhale as you draw your shoulder blades back and away from your ears, then circling them forward and back up. Repeat the circles 5 times, then reverse the circling motions where you can bring the shoulders up to the ears, then roll them forward, downward, backward, and back up. Repeat this 5 times as well. Shoulder circles are great to help relax the muscles of the neck and shoulder area where it is common to get tension after a dislocation. Sit tall and draw the shoulder blades back and down. Squeeze the shoulder blades together and hold it there for 2 to 3 seconds. Return to the start position and repeat this 15 times, 2 to 3 sets. This exercise helps prevent your shoulders from rolling forward, especially when it's in pain, and it starts the strengthening process for the shoulder girdle. In the standing or laying position, interlace your fingers together, keeping the elbows as straight as possible. Use the strength of the non-injured arm to help bring the shoulders up above the head as high as it can comfortably go. Return to the start position and repeat this movement to try and maintain as much pain-free motion in the shoulder joint. This prevents the shoulder from stiffening up and tightening from pain. Choose a laying position if you find that you can get better and more pain-free range compared to the standing position. Find a stick or anything that can act like a stick. In the laying or standing position, have one arm on each end of the stick. With the strength of the good arm, push the injured arm out to the side as far as it feels comfortable without pain. Return to start position and repeat the motion 10 times, 2 to 3 sets. In the standing or lying position, keep your elbows bent at about 90 degrees. Gently turn the arm outward until the fingers are pointing in front of you. Return back to the start position and repeat this 15 times, 2 to 3 sets. Make sure there's no pain with this exercise, and if there is, stop before the point of pain. Stand in front of a wall with the back of the elbow resting against the wall. Gently push the elbow into the wall and hold for 2 to 3 seconds, then relax. Repeat this exercise 10 times, 2 to 3 sets. Stand beside the wall with the arm right up against it. Turn the arm outward as if you are trying to rotate the forearm into the wall. Hold this contraction for 2 to 3 seconds and repeat it 10 times, 2 to 3 sets. Stand with a wall or doorway in front of you. Have your elbows bent at 90 degrees and place the palm of your hand on the side of the wall. Push into the wall as if you are trying to turn the palm towards your belly. Hold the contraction for 2 to 3 seconds before resting and repeat it 10 times, 2 to 3 sets. Do these 7 exercises daily to prevent stiffness from setting in, as well as to start gentle activation and strengthening of the shoulder. muscles. It is also helpful to ice the shoulder daily to decrease the swelling of the joint. And if you're experiencing some neck and upper shoulder pain and tension, a great drug-free pain relief option is using the TENS machine. We have a video that will guide you through how to set up the TENS machine and where to put the TENS machines for fast pain relief. Click on the like button if you found this video to be helpful. Thanks for watching. Until next time.